Hi, I'm Eva. I'm an epidemiologist with Washington County Health and Human Services. Today, I want to talk to you about vaccines, how they work in your body, how well they work at keeping you from getting sick, and how you can get vaccinated in Washington County when it's your turn. We're going to walk through a few slides together, so I'm going to share my screen. So by now, you're probably familiar with this image. This is a picture of the SARS-CoV-2 virus, the virus that causes COVID-19. The spikes here, the red spikes on the outside, are key to how the virus makes us sick and how the vaccines work. So let's talk about the type of vaccines out there. Currently, there are two different types of vaccine that are authorized for emergency use in the United States. The first one is using technology called messenger RNA or mRNA. mRNA vaccines act as a sort of instruction manual for your cells. They use genetic material from the virus itself to teach your body how to make a protein that looks enough like the SARS-CoV virus that when your body sees it, it mounts an immune response, therefore protecting you if you were ever to see this virus in the future. The two vaccines available using this technology are from Pfizer and Moderna, and both of these require a 2-dose series. Next, the most recent vaccine technology authorized in the United States is called a viral vector vaccine. The one currently in use is from Johnson & Johnson. Viral vector vaccines work in a similar way to messenger RNA, but they use a harmless virus to deliver those instructions to your cells. The harmless virus cannot make you sick, but it delivers those instructions so your cells create that spike protein. So then you do create antibodies to fight off the infection if you ever were to see SARS-CoV-2 or have the COVID-19 virus in the future. This vaccine requires only 1 dose. So you can see that the vaccines work in a similar way to deliver those instructions so that your body thinks it's seen the virus so that you're protected if you ever were to see the virus in the future. So now that you know a little bit about how they work in your body, let's talk about their safety and how well they work to keep you from getting sick. So in clinical trials, there were no deaths among people who took the vaccine. Once those vaccines took full effect, there were no hospitalizations among those who received the vaccine. Ultimately, all 3 vaccines are very effective in preventing hospitalization and death and infection overall. So you may have heard some of these questions or concerns about the vaccine in general, and we'd like to take this opportunity to bust 5 myths that we've heard. So the first one is vaccines will change your DNA. In fact, mRNA vaccines and viral vector vaccines cannot change your DNA. They do not enter the nucleus of your cell where your genetic material is kept and are discarded after your body mounts an immune response. The second one is vaccines will give me COVID-19. As we talked about, there are no live coronavirus particles in these vaccines, so you cannot get sick with COVID-19 from the vaccine. The third one is the vaccine was developed too quickly, so it can't possibly be safe or effective. And while it's true that these vaccines were created very, very quickly, all of them went through the rigorous process of safety and efficacy testing before they were used in the public. The fourth myth is I will have to pay for the vaccine. And the fact is the vaccines are free. They're provided by the federal government. If you do have insurance, they can bill that insurance for administration fees, but there will be absolutely no cost to you. And the last myth is you don't have to worry about getting a second shot. Moderna and Pfizer, so the mRNA vaccines, do require 2-dose series, but typically you'll be scheduled for that second dose where you got your first one. And the last thing we like to talk about is vaccinations ultimately are voluntary, but it's up to you, it's up to me, and it's up to us to stop this phase of the pandemic. Health experts say it'll take about 70 to 90% of us to receive a vaccine or be immune from the virus to stop wearing masks, safely hug our family and friends again, and really get back to some sense of normal. There are still lots of things we are learning about the vaccines, particularly how well they work against the new variants that are circulating across the globe, and how long immunity will last. We learn more and more each day, and we at Washington County are committed to keeping you informed of the science. So I'd also like to show some data on how Many vaccines have been administered in the community so far. You can find these data and much, much more on the Oregon Health Authority website. So in Washington County, we have vaccinated over 115,000 people, which is nearly 1 in 5, which is very great news. We expect that number to continue to grow sharply, but we need your help. How can you do that? Well, get the vaccine when you're eligible and when it's available to you. And ultimately, the best vaccine to get is the one that is available. Lastly, I'd like to remind you of the COVID-19 vaccine website from Washington County. Here you can get information about who is eligible, when, where you can get a vaccine and schedule a vaccine appointment, and more information about the vaccines in general. Thank you so much for watching.